22-year-old Kevin Awol is an enrolled midwife at St. Joseph's Hospital in Kitgum. She is one of the beneficiaries of the pre-service training module that was revamped by the Ministry of Health. Awol says her dream of helping mothers deliver safely was crumbling until she benefited from a sponsorship by Ministry of Health through IntraHealth Uganda.
I also started staying like other students and enjoying school life as others they used to stay at school.
Awol is just one of the health workers targeted to improve health services in the country after acquiring advanced skills.
As others also, I acquired that skill, the knowledge, and also that quality of being a nurse. I started being settled to follow that.
With only 10% of the world's population, Africa bears 24% of the global disease burden, but has only 3% of the world's health workforce and less than 1% of the world's financial resources for health. But the basic problem is that not enough health workers have been educated, trained, and employed. Every year, Uganda trains an average of 10,000 health workers for a population of about 40 million people. The current pre-service training is in regard to implementation of the 2008 Global Health Workforce Alliance Agreement that advocated for a quick solution to solve the shortage of health workers. The World Health Organization urges governments to develop long-term human resources development plans, prioritize community health workers and mid-level workers, and develop curricula based on health needs.
Like in the health trained one tutor, in a postgraduate diploma, in a medical education. And then Indra Health also made some of the staff, about 3, to participate in the attendance of leadership management course. 2 of our clinical instructors in training them for clinical instructor course.
Since this thing was instituted, most of the theatre and anesthetic, theatre assistants and anesthetic officers were able to complete their courses, and they completed in time. According to IntraHealth, the emphasis has been towards increasing the number of critical cadres.
Especially for graduates, for learners in hard-to-reach areas, because we know that when you support learners in their areas, they're likely to be retained rather than training people from the center and expecting them to go to the hard-to-reach areas. And then we also improved the inspection of schools, because inspection is very important in ensuring that there's quality in the training of health facilities, training of health workers, and ensuring that the schools are adhering to standards in curriculum implementation.
We have been soliciting for anesthesia, and we were also soliciting for theatre assistants, because we realized that without these courses, it would be impossible to give quality health care to the community.
As we continue with the theatre and the anesthetists, let's also bring in more midwives.
Some of the health workers who have been part of the project say they have learnt a lot.
I can perform my duties very well, with very minimal supervision, very minimal.
However, there have been some challenges in the implementation of this pre-service training program.
With other sectors, when we are dealing with the health workforce, we are dealing with a number of sectors. We are dealing with health, with education, with public service. And sometimes getting things done is delayed because you have to deal with different bureaucratic processes. So in hard-to-reach district, it's very hard to get a student that has had good grades that can get them into the health training institution. Africa
alone requires financial needs of approximately $2.6 billion a year to manage its health sector challenges. Walter Mwesije, NTV.
Thank you.